Go for it.
Tay-Sachs disease is a rare neurodegenerative disease and is genetically transmitted from parent to offspring in an autosomal recessive manner, meaning both parents must be carriers in order to have an affected offspring. It's due to a mutation on a single chromosome, number 15, and the disease is deadly. Tay-Sachs is named after its founders by ophthalmologist Warren Tay and neurologist Bernard Sachs. The mutation is caused on a single gene on chromosome 15 called the hexosaminidase gene, also known as hexa for short. This gene is located at the location 15q23 and is approximately 35,000 base pairs long and is made up of 14 exons. The mutation, however, is not a simple one. To date, there are over 100 different mutations causing Tay-Sachs, including 65 single base pair substitutions, 1 large and 10 small deletions, and 2 small insertions, but they all have the same effect. These mutations cause the metabolism of GM2 ganglioside to no longer be regulated in the lysosomes of neural cells, and the buildup of this enzyme causes cell death. This may seem simple, but the excess of GM2 ganglioside causes a number of different effects on the human body.
This disease has very serious impacts. Although a juvenile and adult form exists, the most common is the child form. The symptoms usually occur between 3 and 6 months, starting with reduced muscle tone. This disease is often diagnosed at this stage due to a cherry red spot found in the back of the eye. This is due to an accumulation of gangliosides around the cherry red spot. After that, the disease worsens very quickly. The timeline of symptoms progresses as follows. Increased startled reflex, seizures, vision impairment and blindness, hearing difficulty and deafness, mental retardation, paralysis, dementia, and eventually death. On top of all this, patients experience psychomotor degeneration. This means that we're unable to control our muscles the way we want with our brain. Death is most often caused by infections in the lungs, such as pneumonia. However, it could be caused by the increase in gangliosides in your brain. More importantly, even though this disease is always fatal and there's no cure, there are concrete ways to improve the quality of life of patients, such as feeding tubes for when swallowing becomes too difficult, anticonvulsant medication for seizures, and physical and respiratory therapy. In terms of respiratory therapy, chest physiotherapy is the most common, since there's an increase in mucus in the lungs which needs to be helped. In terms of physical therapy, this is used to help joint stiffness and reduce muscle pain.
Go.
The advancements in science are busy at work trying to find a cure for Tay-Sachs. The 3 main treatments or research under experimentation are enzyme replacement technology, which would inject the missing enzyme into the body, much like insulin for diabetics. The others are gene therapy and substrate reduction therapy, which would involve manipulating the brain's metabolism of GM2 gangliosides by bypassing the defect of the hexa gene. You may think that you don't need to worry about Tay-Sachs disease because it's rare, and you might be right. But Tay-Sachs does show a tendency to be more common in certain populations. Tay-Sachs disease is 100 times more common in Ashkenazi Jewish individuals. About 1 in 27 Jewish people are carriers, and 1 in 3,600 are affected by the disease. Comparatively, in the general population, 1 in 280 people are carriers, and 1 in 320,000 are affected.
Thankfully, we can screen for this disease, greatly reducing the likelihood of transmission. So the take-home message is, if you're considering starting a family and you think you might be at risk, go get tested.